The term palliative care describes a wide spectrum of activities that are intended to support dying patients. These activities include keeping the patient comfortable through support and management of pain and symptoms, helping families to stay engaged and informed. It furthers to support families to deal with the inevitable emotional issues and stress associated with dying. Palliative care is based around the idea of improving end-of-life care for all. The term end-of-life care is used interchangeably with palliative care as it is focused around caring for a patient with a life-limiting condition. An increase in demand for palliative care is expected to be one of the many consequences of the continued growth and aging of Australia's population. Palliative care is not just for the aging population. Individuals diagnosed with cancer, motor neuron disease, Parkinson's disease, dementia and Alzheimer's disease, and heart failure are cared for under a palliative care-based system. Palliative care focuses around a collaborative approach by implementing a group or team of workers to support the family. A team of palliative care meets once a week on average to discuss the patient's spiritual, psychological, and medical concerns and then implements a treatment plan that is appropriate for that patient. The Department of Health and Human Services provides standards that the patient can expect to receive during their palliative care journey. This extends to a well-developed care plan, holistic assessment, good communication, and coordinated care. This is all done under the care of a team, which includes a doctor, nurse, physiotherapist, psychologist, counselor, and other allied health professionals. A recent study was conducted to examine individuals' attitudes towards palliative care. Participants were asked to respond on a 5-point Likert scale from strongly agree to strongly disagree to the statements A. Palliative care can make patients feel better, and B. Palliative care is offered when nothing more can be done. The majority reported that palliative care is beneficial. Almost all participants were familiar with the term hospice, but only 34 were familiar with the term palliative care. A majority believed that palliative care was offered when nothing more could be done. The view that this is a last resort is a barrier to early referral. These results may reflect a lack of understanding or knowledge of palliative care, its role and resources it offers. Physicians provided with the training and education on palliative care showed an increase in control and management of patients' pain and symptoms. Physicians who were enrolled in a 3-day course on effective communication with an emphasis on palliative care reported higher rates of patient self-confidence and effective communication between physician-patient, which allowed more therapeutic relationships. The patient-nurse relationship was regarded by patients as more personalized and humane under the care of a nurse who trained in palliative care. Recent research indicates some improvements in palliative care for cancer patients. The study's findings indicated the benefits of antipsychotic medication, olanzapine, in reducing chemotherapy-induced nausea and vomiting opposed to standard anti-emetic therapy. Palliative care teams work closely with researchers to understand and better treat patient symptoms to allow a patient a comfortable life. Recent literature presented a limitation of palliative care consultations based in hospitals. The multi-center randomized trial examined the effectiveness of palliative care-led consultations for families with post-intensive care syndrome. Compared to routine family meetings conducted by ICU teams, palliative care-led consultations do not reduce symptoms of anxiety and depression experienced by family members. Palliative care is of great significance due to the growing and aging population in Australia and around the world. Costello 2004 explains that our life expectancy rates continue to grow. This suggests that palliative care is of great significance on both a global and local scale. Palliative care is not only of significance due to Australia's ageing population, in addition, it allows people's wishes to be fulfilled. Switzerland and Duguid, 2014, explains that people want to die at home supported by family, friends, and under an effective service. Palliative care was first founded or brought about in the UK after practitioners wanted to care for cancer patients and allow their patients to die with dignity. Since Cicely Saunders founded palliative care in 1967, this form of healthcare has grown, and there are many organisations within Australia that are based around the premises of palliative care. However, the research, funding and education allocated to palliative care needs to continue to grow with our expanding population. Education of palliative care is vital and should be achieved through mass media, as many individuals do not understand the importance of the principles of palliative care. There is a greater need for discussion surrounding death, the terminally ill, and our aging population, including services available such as palliative care. Personal reflection. The principles that underpin palliative care can be used to establish therapeutic relationships with my client as a future psychologist. Palliative care focuses on an holistic approach and emphasizes on the individual, which reflects the fundamental work of psychologists. The focus on improving an individual's life is a primary role of a psychologist. Many principles found in palliative care can be used during my career as a psychologist.